And welcome to the World Doc Allen podcast. I'm excited to welcome the program World Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is, what do you know about Narcan? What is Narcan?
Well, Narcan it belongs to a large group of medications that reverse narcotics. And it's been around since the late 70s, and we used to give it to babies when they were born and they were a little bit poopy, and we thought it might be something to do with maybe some of the narcotic medications mom just got in labor.
How is Narcan used?
Well, it can be used in many different ways. You know, right now we've got paramedics using it, we've got basic life support, we've got advanced life support, we've got police, we've got doctors, we've got mid-levels. A lot of people are using it for a lot of different reasons, but it comes in different ways. You have a nasal spray, you have an auto-injector, you have an atomizer, you have a syringe. You can give it in the nose, which happens to be the most common way. Give it in the muscle, under the skin, under the tongue, and in the vein. So the most common route is the nose. It's easy to do. Of course, you should be breathing for that.
How long does a dose of Narcan last?
Well, it's hard to say for sure, but you can say or guess maybe 3 hours, but there's two problems that make it difficult to guess how long it'll last. In the first place, if you happen to be a paramedic or a police officer arriving on a scene, you don't know what the patient has been given. You don't know the kind of medication, whether it's fentanyl, heroin, cocaine, or whether it's meth and laced with a narcotic. So you don't know what they've been given. The other problem is you don't know how much they've been given. So you really have to be careful and you have to watch. For example, there's a new group of illicit medications now called nitazines, and they are about 50 times more powerful than morphine. It depends on, there's 20 of them, so it depends on which one you're taking or getting.
What are the risks of using Narcan?
Well, there are two. You can overdose, in which case the patient can go into withdrawal. And withdrawal is no joke, especially if you happen to be in somebody's house or in an ambulance. These people can get quite violent. The other problem is that the medication or the drug that the patient is taking may last longer than the Narcan. So you can't rest on your laurels. You can't hope that you've given them the right amount. All you can do is give what you can give and watch them to see if they need another dose.
All right. The best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was the World Doc Allen podcast, guys.